A lot of my experience comes from working labor and delivery for 17 years. Gives me a lot of experience with acute pain and using regional analgesia and also IV analgesia techniques. In that, I've seen sometimes where you go in and you talk to a patient. Had one lady that went ahead and called me up. The nurse says, you know, Don, patient in room 2 is hurting. She has an epidural in. Okay, I'll go down and check it out. When I go down to the room, I go in there. There's a lady laying in the bed in labor. She has oxytocin going, Pitocin to stimulate her contractions. And her mother is sitting over there in the window seat. I have the advantage of being able to look at the fetal monitor and see when she's having a contraction. So as I'm in the room, she has a contraction. I said, well, so how would you describe this contraction to me? Oh, it's a 10. Yeah, definitely a 10. I'm looking at that, I'm looking at her going, these two things don't match up too well. At that point in time, we just switched over to some new cable system there at the hospital, and probably the most popular channel around was the Animal Planet. Sure enough, that was on TV, and there's somebody on there who is wrestling an alligator or a crocodile or something like that. I said, imagine that alligator's in here, and he's got a hold of your leg and he's ripping it off. We'll call that a 10. She says, oh, well, this is only about a 3 then. What was her worst pain imaginable? It wasn't very much. One of the things I did a long time ago as part of my working in emergency services was I took this course by Dr. Jeffrey Mitchell on critical incident stress management. Excellent, excellent course. This is for people who've experienced through their work, usually in the emergency service or military area, an event that overwhelms their psychological ability to cope with it. The search and rescue person that goes out and finds a plane crash where everybody died, including twin girls. The military man who couldn't rescue his friend because bullets were flying over his head, and he feels bad about it because he didn't do enough. The fireman who went in there and couldn't pull the person out of a burning building because it was collapsing on him. But he feels bad about it because that's his job, he should do it. Who do you have talk to those people to help them out? You have someone who has been there. You have somebody who's been through that same situation. That carries a tremendous amount of weight when somebody says, I know exactly how you feel. I've been there too. And can validate their feelings of either that they didn't do the job right or that they did something wrong, anything along that line. Support systems where you have previous cancer survivors, patients that have cancer, that are going through their treatment, that can talk to these people and say, I know what you're thinking. I've been there, and here's the road out of there. That makes a huge, huge difference. It's that walk 1,000 miles in my shoe thing. Those people know that it carries a lot more weight with somebody who's been told they have a GYN cancer and they're going to have surgery. 2 ladies did C-sections on both of them. One of them is her first C-section. We did a spinal with Duramorph. Everything went fine. She goes to the room. Second one, it's her second baby. Her first C-section had been under general anesthesia because it was an emergency. And for her post-op pain management, she had a PCA pump. Push the button, you get the pain medicine in your IV. Went back to see them the next day. They were both in the same room. I said, well, how is everything? The lady who, it was her first baby, her first C-section, she said, it was terrible. I hurt all night long. This is not working at all. I can tell you that right now. Lady in the next bed looks over and says, sweetheart, you don't know how good this is. She had something to compare with. She had pain relief by a PCA pump in the past after the general anesthesia. So her look on things was a little bit different. And talking to the lady who was her first C-section, yes, she was getting some decent pain relief from it. When she coughed, it hurt. I said, yeah, not going to be able to take care of all that. If we get that much pain relief, then we have to worry about some other things. Because there are downsides to everything, ups and downsides to everything in life. What patients think. Patients sometimes have the totally wrong notion. We have to go and explain everything. We're medical people. We think medicine. We think nursing. That's us. 24 hours a day. We hear something that we think of it in the context of the medical field. I was working at an Air Force base and they said something about an ACP. And I'm thinking, ancillary care provider, what are they talking about? No, it was an airspace control plan. I had to switch gears entirely out of that. But I went in to talk to a lady about getting an epidural, and Do you have any questions? No, no, no. Later on, nurse calls me up, Don, patient in room 6 wants an epidural. Okay, great. I go into my little red cart, start to open things up, and she says, I have one request for you. I said, certainly, what is it? Could you do this from in back of me? Because I'm really afraid of needles and I don't want to see the needle. I just looked at her and said, yes, ma'am, be happy to. Went back, did the epidural. We left the room. The nurse looked at me when we got outside the room and said, how could you keep a straight face? I said, simple. She got what she wanted. I did what I was going to do anyhow. Everybody's happy. You never know where your patients are coming from. They've seen a lot. Not necessarily truthful, not necessarily relevant, but they've seen a lot. They'll come up with that type of stuff.